Yeah, Dr. Philippi with 21st Century Pain Institute, and here we have the world's most advanced handheld diagnostic and ultrasound unit called the Butterfly IQ. And I'm sorry, I forgot your name.
No worries, Amy.
Yeah, the model, Amy. It doesn't come with a model, sorry. But she's showing us how this works. So go ahead.
Yeah, so I'm looking here. I've gone into my MSK preset. I've plugged my probe into my iPhone or my iPad. I go ahead and I select the imaging parameter that matches the anatomy that I'm looking at. So here we're looking at the shoulder. I can see a short axis view here. Everything from skin, deltoid muscle, bursa and biceps tendon in the bicipital groove here.
Hold it for me.
Thank you.
Okay.
So what we can do is we can move down.
Maybe you could point exactly what structures
Sure.
you're looking at.
So here's the bicipital groove.
Okay.
Okay, the very white, bright bone area.
Mm-hmm.
Here's the biceps tendon sheath around. Has a little bit of synovium or certainly some.
This is probably the long head tendon attaching in there.
Yep, and here's the long head looking at us. I'm in short axis right now.
Okay.
So as I come down the arm, we can see the biceps here.
You missed
Still
out
around.
because we treated Miranda Kerr a few years ago.
Oh,
Yeah.
do you know I grew up in the same country town in Australia as her?
Yeah, well,
Yeah.
we may be using one of this on when she comes for her
Amazing.
stem cells.
Tell her
yeah.
you met someone from Gunnedah. I'll
Okay.
write it down.
All right, Gunnedah.
I played netball against Miranda Kerr.
Well, you did. Wow.
Yeah,
At least she remembers you.
So, so now I'm in long axis. So you can see here a little bit of arthritic change in the top of the bone here of the humeral head.
That's a pretty clear image.
And here
wow.
now, here's the biceps tendon as we stretch down.
All right.
Down into
Now,
biceps
did
muscle.
they use this on veterinarian applications before?
Not this particular probe. We're developing a vet preset that should be out soon.
So you can even use like on a horse and
Correct.
stuff. Oh, it's that powerful.
Correct.
And this is powerful enough to diagnose the hip.
Correct.
Wow. And you don't need a curvilinear
No.
applicator. Wow.
No. So for very deep applications like the back of the liver or deep spine,
Okay.
you can certainly go into an application that goes all the way down to 30 centimeters, which is industry standard. So if
Okay.
you had a really, really big patient, you could certainly simply swipe up and down to go down
and-
up to a depth of 30 centimeters. And again, I'm just swiping side to side for brightness to adapt to different body types.
Now, could you see any tears in the labrum or biceps tendon?
Alrighty, so you can see here, like I was saying earlier, the biceps tendon looks like there is a little bit of a cleft here, so perhaps some tendinosis.
Yeah.
Not a large biceps tendon effusion, which is usually the sign of a big tear, but certainly some cleft and some arthritic change, so some tendinosis here.
Yep, and we did the stem cells last month. She's already getting more range of motion, so yeah,
Great,
give some time to
fantastic.
graft.
Great.
All right. Well, thank you. That's how we do the shoulder, and maybe we could demo a hip. All right. Thank you.